In recent interviews with GBC, Minister for Health Paul Balban and Clinical Nurse Manager K. Rajkumar described a smooth-running service. One which, according to the Minister, had taken on board all but one of the recommendations made in last year's mental health report. However, since these interviews aired, GBC has heard from individuals registered in the system, as well as family and friends of vulnerable individuals, whose experiences do not match the official accounts. As an example, 12 individuals, all of whom have been registered service users for years, claimed they were not contacted or visited at all during lockdown. Given the sensitive nature of the subject, those involved spoke to GBC on condition of anonymity. As such, the following names have been changed. Frank spent 6 weeks at Ocean Views within the past 12 months. During his time here, he says that he did not see a psychologist and was told by a nurse, "The only thing we can do for you here is give you medication." During his stay, Frank says he told a psychiatrist he was afraid he might self-harm and was told an appointment with a psychologist would be made for him. He says it never happened. After leaving, Frank claims it took 6 months to get a referral to see a psychologist at the Coaling Islands Mental Health Facility. He estimates that he contacted Ocean Views over 20 times and emailed them for several months to get this appointment. He says he was not contacted during the lockdown and that despite coming close to breaking down, he says he felt he did not have access to professional help. Frank's is not an isolated case. GBC also heard from Sarah. Her brother has been in the system for decades. She knows several others in the same situation. Sarah's brother is one of many vulnerable individuals in Gibraltar whose relatives believe don't receive adequate support. Several don't have mobile phones or computers, making them difficult to contact, but their families say more could be done to reach out to them. Sarah is her brother's next of kin and says she receives no information, no follow-up or treatment plans, and if he misses his fortnightly appointment at Coaling Island, she says this is not communicated to her unless she calls up herself. GBC also heard from Lee, who sought counselling after being diagnosed with a life-threatening illness. The earliest appointment available to her was 3 months later. This excessive waiting time to see a psychologist is something that has been reported by many others. There seems to be acknowledgement in the community that mental health services in Gibraltar are better than they ever have been. New facilities, increased personnel, improved treatments and awareness campaigns have all contributed, no doubt, to creating a healthier environment for mental health on the Rock. But this is an area that has historically been under-resourced, and to some users still feels uncoordinated and difficult to access. The Mental Welfare Society says people look for mental health provision which is holistic in its approach and robust in its support. It seems that while improvements are being made, there are still many who feel angry, frustrated and forgotten.